key questions to set the scenes, methodological issues, and the betrayal of pain that is the first body cry for help. This is pain. The body saying, listen to me, help me, I need something to change my suffering. The questions to set the scene. Who is the first and last protagonist of every medical consultation? What do symptoms mean? What are the signs? And what does diagnosis mean? First point, the human body, our body, is the first and last protagonist of every medical conversation, but currently it is more and more neglected and betrayed. Symptoms are urgent requests for attention. They are a cry for help, particularly when there is pain as a leading symptom. Signs are the objective findings we can find with a very careful physical examination. We must read the body. And this is totally neglected today. And then diagnosis, from the Greek, means to recognize the disease through two leading information, symptoms and signs, and then targeted exams. No tons of exams, and then I hope to find something. Who listens to the pain syndromes? Pain is the most neglected and normalized symptom. This is the betrayal. Psychological explanation, you are distressed, you are stressed, you are depressed, you are too anxious, you don't like your body, change partner. What's the point? Pain has a solid biological etiology, and sexual pain is in absolute the most neglected. What are the enemies? In quick. Inadequate physician training, 0 in sexual medicine. Time restrictions, 15 minutes today, sometimes 12 minutes. I cannot even ask, how do you do? And not examine. Economic and financial priorities. So my point, in the darkness of the diagnostic omission, there is a must change. Proactive investigation of early pain symptoms, say the predisposing factors, for example, to endometriosis, chronic pelvic pain, bladder pain syndrome, vulvodynia, irritable bowel syndrome, and so on. So the body that has the fact and the neglect is progressively marginalized in the medical consultation. Telemedicine is the betrayal, final. The patient, listen to that, is the spokesperson for that body. Every patient, the child, the old, is a spokesperson. The voice should improve the dialogue between the body and the physician. Yet, she's usually interrupted in the first minute. Imaging today is the preferred diagnosis because we have the St. Thomas syndrome. We believe only what we see. But there is a major point here, that every disease has a long phase below the visibility, and yet the damage is already there. So you will give birth with pain. It's normal to have pain when you have periods. Pain has been normalized for millennia, but still it is. Particularly, we see 3 major clusters of normalization: menstrual pain and premenstrual syndrome. Menstrual worsening of inflammatory diseases and autoimmune diseases during periods. Could be endometriosis, bladder pain syndrome, vulvodynia, asthma, epilepsy, and also the menopause-driven pain symptoms, arthralgias, all the symptoms of the genitourinary syndrome of the menopause, arthralgia, as I said, cystitis, and sexual pain. What is the truth about pain? And this is a major universal truth in every human and animal. Pain is almost always caused by a microscopic biological damage causing a biological stress. And the microbiome in the gut is the first target of every stress, physical and psychological. This will cause a response in our immunitary system, that is our army, and this causes inflammation, that is a microfire inside our body. So we have a war inside the body. And a longer war means that you will exhaust your energy, your living energy. We have two opportunities when we have this war. One, to remove the etiological factor, limit the damage, and restore the anatomical and functional tissue integrity with what we call acute resolving inflammation. But when we do not recognize the etiology of pain, when we do not remove this cause, or when the damage is too serious, then the persisting damaging factor will create a chronic, non-resolving, very destructive inflammation, leaving just scars at the end. So my metaphor, that is true for every disease in every part of our body. Let's look at every natural history of a disease like a movie with two times. In the first time, we just have symptoms. The first photograms of the movie, and it's there that I can change the plot. If I wait until I see the lesion after 8 to 12 years, like in endometriosis, or think about breast cancer. 1 centimeter of breast cancer, stage 1, has 1 billion cells and started 10, 15 years before. So you understand that we arrived too late. And my challenge is to go there. That's why I'm so grateful to work with this fantastic group. So if I look at this girl, she has to face 450, 480 cycles. Just 100 years ago, we had 140, 150. So we tripled periods. And this means triple the inflammation associated with periods. How much pain can and should be prevented in this girl? Look at data. In Italy, we have the same data. This is just one data from UK. 76% of gynecologists normalize pain. So the vast majority say having pain at periods is normal. And the younger the adolescent, the worse the neglect of the biological truth and intensity of pain. So another metaphor, when I talk about endometriosis. Endometriosis is a biological civil war. It is our army against our tissues. Within the body, it is an immunitary battle with genetic, endocrine, and microbiome-driven fights. I presented about that at the International Congress in Dubai just 10 days ago, with huge physical and emotional losses. This is the point. And what happens when we deny the biological evidence of pain? Pain changes its nature. At the beginning, it is nociceptive, we say. Send a friend that says, beware, there is something wrong. Do something. But if we deny that there is something wrong, biologically speaking, and there is a battle within the body, then it becomes a disease per se, becomes neuropathic and nociplastic. So this huge inflammation will spread up to the brain, and is the first cause of depression. Neuroinflammation causes depression associated to chronic pain. So when sex hurts, for example, sexual pain disorders, vestibulodynia, pain at the entrance of the vagina, recurrent cystitis, what should I do? This is a paper of mine, very well commented by the reviewer. I should have this picture on my desk, as I have even at university, because we must share the language. The image of the genitals, this is one of my residents, the words, symptoms, etiology, and meaning. Every symptom has a meaning. We must communicate it with the patient and the other colleagues. The pelvic floor role in pain, the biomechanics of pain in the genitals, 50% of the etiology is the muscle. Nobody pays attention to that. And then the strategy to cure pain and improve sexuality. So, looking at the pelvic floor muscle, I explain to my patient like a double-edged door. If it is tightened like this, and I see it immediately from this point between the vagina and the anus, if it is retracted like this means that I have a very tightened pelvic floor, and she will have for sure pain at intercourse, constipation, and recurrent cystitis. Just looking at the genital. And if I see this tightened pelvic floor, I know the comorbidity. Vulvar pain, lower urinary tract symptoms, cystitis, and also the urge incontinence, constipation. How can I evaluate pain? The visual pain scale, but also I do that very simple. Use 3 colors along the month to see the intensity of pain you have during periods or in other moments. This will help me to find the worsening of pain during periods or at ovulation and help my patient with selective treatment. So key points: better treatment for healthcare professionals, because pain is key, is the leading witness of our work. Second, the role of microbiome in women's health, fantastic, in the shadow of clinical awareness, by the way, improving patient-doctor collaboration and communication. So our healthcare professional, nurses, physiotherapists, doctor, of course, should be better trained in diagnosing and treating pain and related health issues, and follow how to talk about, because it is really useful for the daily practice. In conclusion, women's pain should be recognized as a biological warning, not ignored or normalized. This is my main take-home message. Doctors need better tools, train, and believe and listen to women. Activate the brain. If you have pain, something is wrong. Nothing mysterious and nothing difficult. The microbiome plays a crucial role. Fantastic, another conversation. Better communication, how to talk about, and thanks a lot for listening to me.